Well, thank you, Mr. Chairman, and thanks to you and Ranking Member DeGette for holding this hearing, and thank you to all of our witnesses who are here today. I have the privilege of representing many physicians across my district because so many of them work in the Texas Medical Center in Houston, and I feel so lucky to represent them because they have been so engaged on these issues and have really educated me and shared with me a lot of their concerns over the years. And since I got to Congress, one of the top issues I've heard about from them is the Medicare physician fee schedule and the need for Medicare physician payment reform. So I'm really glad that we're having this hearing. For years, the physicians that I represent have faced declining reimbursement because the current rates just haven't kept pace with inflation or with the rising practice costs. And this has created significant financial strains for them, and I know it has for physicians across the country. And as we've heard today from our witnesses, for so many physicians, these rising costs are just unsustainable, and they're having to limit the number of Medicare patients they see, or they're having to opt out of Medicare entirely. And other physicians, as we've heard, have had to consolidate or close their practices. Some physicians are choosing to retire early because they face a ton of burnout from these rising costs and tons of challenges relating to staffing and to dealing with all of the challenges that this brings. So it is clear to me, and I think to everybody here, that the current Medicare physician payment system is contributing to the physician workforce shortage. And it's not only harmful for physicians, obviously it's harmful for patients. And it becomes more and more difficult for patients to access care when there are fewer physicians available. And we all know that access to care is a huge challenge for people all across the country. And so, whether it's the long wait times, whether it's having to travel further to see a physician, the likely delays in accessing care are going to lead to worse health outcomes. So we really need to do something about that. Medicare patients and all patients should have access to their physicians and to quality health care. So one of the things that I am glad that Congress has kind of done some temporary fixes to try to address this, we really need to focus on long-term reform for Medicare physician payments to ensure that physicians who treat Medicare patients receive sufficient financial reimbursement for their services. And a really important area of reform is just ensuring that these payments are keeping up with inflation. So despite other fee schedules having a formula that increases with inflation, Medicare physician payment updates don't currently account for inflation. And that's contributing to declining reimbursement rates for physicians. So, Dr. Fox, can you talk about how this lack of an inflationary update is directly impacting the viability of physician practices?
Well, as you mentioned, every other part of the healthcare ecosystem has a built-in inflator every single year. For independent practice and just for physicians in general, we do not. So it becomes harder and harder to maintain a sustainable practice. This is all about trying to maintain access for our patients. We want our patients to have a viable, robust practice to go to. And if we're losing independent practice, patients lose access.
Well, your answer anticipated my next question, of course, about the impacts on patients. But can you talk a little bit about what you think Congress can do to ensure that inflation is accounted for in the Medicare physician payment updates?
Well, the most important thing, in my opinion, is to link annual predictable positive updates to the Medicare Economic Index. I think that is the number one thing we can do to help preserve adequate pay, access for our patients, and the preservation of independent primary care.
Great. Well, I know that that's important to the people I represent, both the people who care for patients and the patients. Everybody in my district wants to see this happen, and I think that this is a very achievable, doable thing that we should be talking about on this committee. I really appreciate your weighing in there and all of you coming and testifying and sharing your expertise and insights with us today. And Mr. Chairman, with that, I will yield back.